you're on.
Hi Shayla, my name is Sarah. I'm one of the nurse practitioner students at Nebraska Methodist College, and I'm here to do a spinal assessment on you. Is that okay?
Yes.
Wonderful. Shayla is a well-developed, well-nourished 45-year-old female. She answers questions appropriately, is a good historian, and her vital signs are normal today. So let's get started.
Okay.
And I've washed my hands. Shayla would normally have a gown on. It would be open to the back for easy visualization. In this case, she is obviously fully closed. So I'm going to have you turn around, and I'm noting the position of Shayla's neck and cervical spine and the posture of her back. Her neck is midline. This scapula area appears symmetrical, and her posture is erect in her back. And now what I'm going to do is palpate, starting with C7, and I'm palpating the spinal processes, noting if there are any step-offs. Any pain with that, Shayla?
No.
Okay, wonderful. I am also going to palpate the paravertebral muscles on either side of Shayla's back. Any pain, any discomfort?
No.
And I'm going to palpate the cervical facets. Any pain with this, Shayla?
No.
Right above C7. And I'm also going to palpate for the sacroiliac joints, noting that they are symmetrical. Any pain with that, Shayla?
No.
Okay, wonderful. And also noting that the iliac crests, if you would bend forward just a little bit, they are in normal position and they're symmetrical. Okay, you can go ahead and stand up. I'm sorry. Now, what I'm going to have you do, Shayla, are some range of motion tests.
Okay.
We're going to start with your neck, and if you would, go ahead and flex your neck down, your chin to your chest. That's good. And back up. Now, if you would, look up towards the ceiling. Wonderful. Flexion and extension are normal. You can look back down. I want you to rotate your neck from side to side. Rotational movements are normal. And I would like for you to do lateral bending at this point, from side to side. Lateral bending motions are within normal limits. Okay, so we're going to do your back now.
Okay.
And what I'm going to have you do is kind of the same thing we did with your neck. I want you to bend forward and touch your toes. And I'm noting that her spine is in a straight line, palpating these processes again in her spine. And you can stand back up, so flexion movements are normal in her back. And now I'm going to have you extend, just like this. That is perfect. Okay, flexion and extension movements are normal. Now, I'm going to have you rotate from side to side again, Shayla. There you go. Rotational movements are normal in her back. And I'm going to have you do side bends. Excellent. And the same on the other side. Lateral bending motions are normal. Are you having any pain anywhere else, Shayla?
No.
Okay, wonderful. At that point, if she was having pain, I would note where that occurred and do more inspection and palpation on there. And also, I do want to note that there are no skin abnormalities. The spinal column is midline and straight. I did not note any bruising, any swelling, so Shayla does not have any more pain. So At this point, I'm gonna have you walk across the floor,
Okay.
and I'm just gonna watch the way you walk.
Okay.
Okay. And turn around and walk towards me. Okay. Shayla's gait is smooth, continuous, there were no stutters, and it has a nice even flow to it. She's full weight bearing, and it looks great. So I think this will conclude our examination for the spine. Thank you.
Thank you.